the healthcare system has all of these contradictions that are laid bare when it comes to providing treatment to crash victims. I think it's actually very interesting. Generally speaking, the healthcare insurers are playing this gatekeeping role that by and large prevents people from getting the care that they need and controlling the healthcare choices of doctors and their patients that really the insurers should just be paying for, not controlling. What's interesting in a no-fault context is that the gatekeeping function is removed from insurers. At least it is under New York system, and it's only starting to be introduced very gradually under New Jersey's no-fault system. What that means is, generally speaking, it is the healthcare provider and patient's decision whether to undertake any particular treatment. And the insurer is not permitted to say, oh no, if we don't pre-approve that treatment, then you're not going to get it, the way you experience so often in the commercial health insurance context. So crash victims, in a way, actually have gotten out from under this gatekeeping. And I think it shows that it is, it's a viable system. We don't need to have all of this gatekeeping. And I think you could study outcomes and delivery of care across the different contexts, the no-fault context versus the commercial private healthcare context, and see what the impact of the gatekeeping is. And I would bet anything that it's not a savings of money to the system, it's just a savings of money to the insurer. Another issue that you find with healthcare in the post-crash versus other healthcare contexts is that the insurers don't want to pay for things like physical therapy unless it's going to enable them to not pay for some other more expensive treatment. So they do use it as a hurdle, and they'll require it before you get an MRI in the commercial health insurance context. Before you get a surgery, well, you have to do 6 months of PT. But they just use it as a barrier. PT is one of the least well-funded by private insurer services that you can find. Oftentimes, the insurer is paying something on the order of $15, $25, maybe $50 for a PT appointment. The patient is paying something like $75 or $95. So the bulk of the cost of the copay goes on to the patient. And the reason insurers, I think, underfund physical therapy compared to other types of treatment is because it's treatment that so often works. It's a great treatment modality, better than more invasive modalities like injections and surgery. It involves patient effort and active people who are injured while doing sports or while, operating a bike in traffic, things of that nature, they take to it because they see through their own activity, by participating in the treatment and doing the exercises, that they get better. And so it's effort dependent, and that's really a good thing for a lot of patients. And I think that patients should be taught to participate more in their own healing than they often do with so many medical procedures that involve getting a surgery or taking a pill, right? So physical therapy is another area where it gets treated very differently in the no-fault context versus in the private insurance context, that has great implications for people attempting to recover from orthopedic and other injuries after a crash. I think that we just need to fashion a healthcare system that really addresses the fact that the major burden of orthopedic injury and disability comes from private motoring, and that there are ways of treating these injuries that may not suit the health insurance or even the medical establishment's perceived needs, but that there's just an enormous burden of morbidity and mortality that comes from motor vehicle crashes that we've got to reform our medical system. And I think the no-fault practices, the reimbursement practices, and the rules that you find in places like New York and even in New Jersey and a few other states really point the way to how we should be reforming that, rather than just saying, well, people get hurt in a crash, accidents happen and they'll just pay for it however they end up being able to pay for it. Maybe they won't be able to pay for it at all. Maybe they'll just live out their lives disabled because their bones aren't set properly. I mean, there's so much that can be done with modern orthopedic medicine to bring people back to a state of full or near full recovery